Today, sitting here, you can look at all these technologies which are here. There are so many of them. What is going to happen is that technology and innovation are going to be synonymous with access to health. And what I'm seeing, sitting where I am looking at innovation and technology, is that we could go either coherently together or we can go completely divergent. We saw the worst of the response when it comes to COVID. I think we left the community behind paying a price today. Whereas when you look at HIV or TB or some of the other works that has happened, we have really been able to see tremendous progress. So what we want to do is to do two things. What can we do to make sure that we don't forget the lessons that we have learned around the centrality of communities? And when we are going through this digital transformation, what are the things that we need to be thinking?
Thank you, Pradeep. As usual, you're asking always a very good questions, and I think replying to all those series of questions needs probably a book. But I want to just focus on only one thing today. At the last mile is a key, and we are not understanding completely what is going on there. I had a privilege to be Undersecretary General, to be Executive Director of UNAID, to be working with UNICEF in different places, but to be minister in my country.
Street of a village. Everybody talk about the mindset, the community empowerment. We in India have been able to do it, and I'm going to cite an example. Asha. Asha means hope. We have a million-strong workforce of Asha workers. They are popularly called as Asha Bahenji or Asha sister. They are the point of contact between the healthcare system and the rural women. They come from the community. They are from 20 years to 45 years of age. They are slightly qualified. They are trained in the basic healthcare system. And then they become responsible for the reproductive, maternal health, neonatal health, child care, adolescent health. Whatever the government schemes come, they are delivered to the Asha Bahenji. And Asha Bahenji does not preach anything. Asha Bahenji goes to house. She knows about the mind blocks, the mindset, the fears, the apprehensions, and the women sitting on a cot in the house, in the hut. They can talk fearlessly and they can repose faith to Asha Bahenji. And she can allay her fears. She can motivate them for an institutional delivery. She can guide them for an immunization of the child. And she has to make number of contacts again and again. And she does not preach. She goes at a time when the woman is available after her household chores. The healthcare delivery system all across the world, they came to a standstill because of COVID, because of stringent lockdowns. But in India also, it came to a standstill. But the reproductive health services, the immunization services, they continue to get moving because of the Asha Bahenji. And these women were responsible for inaugurating more than 2.2 billion doses of vaccines, overcoming the difficulties of terrain, mountains, snow-filled gorges, bad weather, sometimes risking their own lives, but they kept the system moving.
Fascinating, because what you're saying is that eventually it comes down to the individual combined with technology.
Yes.
And that is where we are looking at it as the first mile, where we need to bring that transition. And the Asha is a great example from India. And I'm sure that we are seeing that community health work happening country after country. So let me go to the private sector, because I also want to see where does you're from the private sector, you're running hospitals, so that is good. Let me look at from the private sector perspective. I would like to ask Dauda and from Medtronic Labs, what needs to change? How does the private sector engage with the community? How can we really build that? And Ruben, if I may ask you very briefly, 30 minutes, 1 minute. How can we really start that transition? How can we engage the communities?
Okay, thank you.